Hello, my name is Monica Martin, and my teaching project is going to be on music therapy and dementia. So first of all, we need to talk about what is dementia. Dementia is a progressively debilitating disease of the brain that can cause long-term and gradual decreases in a person's memory function that can become severe enough to impact an individual's ability to deal with daily functioning. Some of the characteristics of dementia is that dementia is common in older adults, but it's not an inherited part of aging. Also, Alzheimer's dementia is the most common type of dementia. Evaluations include obtaining a health history, physical and functional assessments, focused labs, and sometimes possible brain imaging. Primary treatment goals are to enhance the quality of life with the patient with dementia, maximize functioning by improving cognition, mood, and behavior. So when we think of dementia, dementia is plaques that form around the outside of the brain. When these plaques build up, dementia changes in stages. It goes from a mild to moderate to severe stages in the disease process. As you see here, you can talk about the mild stages, which is moderate memory loss and confusion, poor judgment, mood and personality changes. When you get to moderate and you have a little bit more buildup of those plaques surrounding the brain, we have increased memory loss, shortened attention span, inappropriate outbursts, difficulty with language, and inability to learn new things. When you get to the severe stages of dementia, that's when the brain is shrinking along with this plaque buildup around the brain. You have the inability to do the things you used to do. Start seeing some weight loss, some seizures, difficulty swallowing. You start losing bowel and bladder control. And you also have increased sleeping, and you basically lose the ability to function as you used to in the past. Dementia is not a disease that can be cured. What happens with dementia is the disease progressively gets worse as time goes on, and the person eventually loses the ability to breathe and have their heart beat. So again, we talk about the evaluation of the disease and includes a complete health history. Again, physical and functional assessments, focused labs, and some MRI imaging. Primary treatment goals, we talked about enhancing the quality of life. Treatments may both be medications and non-pharmacological interventions, such as the music and memory program, which we'll talk about in a little while. Treatments used to manage the symptoms, but again, there is no cure and the disease is fatal. So the music and memory program. The music program is introduced, so it was determined that music profoundly links to personal memories. We can think of this when we talk about, say, the holidays, and we think of holiday music, whether we're 2, 4, 6, 16, 36, 56, or 65. What ends up happening is we have fond memories of different times in our life based on music that we hear, and it brings back these memories. So the program was designed to enhance the quality of life and bring back these memories to a person who has dementia. The vision was to bring personalized music into the lives of the elderly and then improve the quality of life and cognition by reconnecting the patient to the world through the use of music. Music therapy and dementia. The program is designed to provide assistance, education, and access to music therapy for those with memory loss and other forms of dementia. In the future, it's talked about that music therapy will become a standard of care in the healthcare industry. Music has effects on the brain. A series of recent studies show that listening to music engages networks in the brain. Basically, what ends up happening is the prefrontal cortex region of the brain is one of the last areas that changes over the course of dementia. So there's maximum ability for the brain to function and hear music and have fond memories and increase the quality of life from the actual therapy that is provided. So as you can see here in this slide, areas of the brain that are affected by music, and it shows that many areas are stimulated and affected by the music therapy that is provided to a patient who has dementia. How the program works. So basically what ends up happening is a resident who's been selected to participate in the program. Personalized playlists are created for each resident. Now they're either created from the information given by the patient or the patient's family to talk about what types of music the individual listened to in their lifetime. Music is then available for the resident for activities and leisure. Choice of choosing a source of music that isn't interrupted by commercials is also important because it doesn't increase anxiety or confusion. We use the music to create a mood that you want for your patient. So if you want a more relaxing mood, you're going to pick a more relaxing form of music. If you want a more upbeat, positive mood, you're going to pick a different type of music. And they encourage movement with the music to increase that quality of life, get the person moving, smiling, and engaging in activities. So the program benefits. There are many benefits to this program. It's an enjoyable and enriching activity. It increases cooperation and reduces resistance to care. It reduces anxiety and agitation. It also improves engagement and socialization. It is used as a tool to reduce the use of antipsychotic medications. So in an industry today where we're so focused on reducing the use of antipsychotic medications, this is one of the forms of a non-pharmacological intervention that is used to assist a patient with dementia. There are also different types of non-pharmacological interventions. Some would include, other than the music therapy, massage or aromatherapy. Another one is pet therapy, but this one is more designed to the individual, and it assists the individual in selecting music that impacts them and their quality of life. And here are some references that I used to create the program, or create the PowerPoint rather, and discuss the program. Depending on your facilities and the environment that you work in, music therapy is also being used in different forums. Currently, I know they're using it in hospital for pain management to reduce the use of opiates in pain control. They're also using it to reduce the antipsychotic use, and they're showing a lot of benefits of how music can impact the patient and their diseases. So if you'd like any more information, there is some good references that I left for you to look at. And I'd like to take this time to thank you for listening to my teaching project. And if you have any further questions, please feel free to email me. Thank you.